usually when I'm teaching like fertility awareness, it takes like a 4-cycle practice of understanding like ovulation spikes and temperature and spotting and what different things look like. So it takes time for women to actually understand their cycle if they're charting it, but it would make sense. Just see I will say this. I was very shocked going back to how many women don't know when they ovulate.
Oh my gosh.
You don't know when you ovulate.
No.
Or the fact that it's always very shock. I mean, I talk with women at all ages, or how shocking it is to make the connection that in order to produce progesterone, you've got to ovulate. And progesterone is more than just baby making hormones. It's like mental wellness. It's protective. It's your mental sane. Like it's so many more things than just getting pregnant.
Right.
So I think that is a good tool to start using ovulation strips to at least know when you stink and ovulate, how long your luteal phase is, like when you're in your luteal phase. It's really shocking. I actually had someone I was coaching who was having gallbladder attacks. She felt like they were just random and they were cyclical, but she hadn't been tracking it, wasn't tracking her ovulation, wasn't tracking like when they were happening. And they were happening around her ovulation. She had an estrogen dominance issue. So every time that estrogen would peak in the luteal phase, it would cause a gallbladder attack. But because she did not know when her cycle was, day 1 bleed to day 1 bleed, when ovulation was, when she was in the follicular phase and luteal phase, she was missing this pattern. Like she had done a gallbladder cleanse, she had done all this other stuff, but we noticed it was always after ovulation. It was this peak in estrogen. We worked on that and, she hasn't had it since. So, I mean, I think it's huge.